Hello and welcome to In Conversation with the history holders of the American Dance Therapy Association, a project made possible by the Marion Chase Foundation. My name is Dr. Jacelyn Biondo. When I first conceived of making these videos, I hoped to capture the words of the women who studied with the firsts in our field: Marion Chase, Trudy Shoup, Mary Whitehouse, Alma Hawkins, Blanche Evans, and Lillian Espinack. What culminated in the process was an opportunity to have these women share their stories and their memories in their own words, and to capture these parts of history for future generations. Thank you for joining us, and I hope you enjoy our conversations. So today I would like to welcome Dr. Susan Lovell to our conversation. Dr. Lovell, thank you so much for joining me today.
My pleasure.
So I'd like to start our conversation off with having you share a little bit about with whom and where you first began to study dance therapy.
Yes. Well, I first began to study out of starting a master's degree at UCLA in California, of course, Los Angeles. I started in 1963 because I had stayed at Scripps, where I went to college, which is where I started dancing, to teach for a semester, and then started in fall of 1963. Dr. Alma Hawkins, who was the chair of the department and one of the pioneers in dance education. She'd been in New York with all of the greats back in the day, Martha Graham et al. And she was a very far-seeing person who recognized and saw the beginnings way back then, although the movement therapy process did begin in the 50s, of course, with Marion Chase. But she began to bring people in from the community, from the medical community, the psychiatric community, Neuropsychiatric Institute in Los Angeles. And it was through her that I first met Mary Whitehouse. But Alma was the person who was my primary both mentor and teacher in the graduate program.
Can you share a little bit about what it is that drew you into that area of study? What made you interested in this kind of newer idea of dance therapy?
Yes, absolutely. When I was at Scripps College, there was no dance major at the time. My major was psychology, but my teacher, who I believe her master's was from Wisconsin, University of Wisconsin, in dance. She worked very creatively. We did a lot of improvisation. When we were doing choreography, she always had us just start with kind of following the movement process and finding our own way with it. Mm-hmm. We had a lot of technique, of course, but it was an extremely creative and improvisational experience, and I loved it. I had never really studied dance as a child. It began to be something I thought about in terms of what I wanted to do with my life. And in the choreography class, we had a senior project, a senior solo. And at the time, you probably have heard of Abraham Maslow. He was one of the very pioneers of humanistic psychology, looking at the whole person. And she had invited him, she knew him, and she invited him and his wife to come to the solo concerts. And so I met him and spoke with him afterwards. And he told me about Marion Chase. He said, there's a woman at St. Elizabeth's Hospital in Washington, D.C. who works with psychiatric patients. So that piqued my interest. Because my interest in going into dance and for a master's was probably to think about teaching in college at the time. That was what at the very beginning drew me in. And then I can go on to share how Mary came to UCLA if you want me to answer that now or talk about that later. But
sure, you can talk about that now. That would be great.
I think it was the first year I was there, probably 1964. Alma brought Mary Whitehouse to class. This was the graduate therapist. We weren't dance therapists then, we were the graduate students. So we were her first graduating class of the graduate program that she had initiated. And the experience with Mary was not only eye-opening, but it was emotionally opening, because she asked us, there were about 7, 8, 9 of us, I think, in the room. She said, why don't you show me how you begin warming up or getting ready to dance? So we were all there doing our stretches and our turnings and everything we did. And she stopped us and she said, that's what I thought. And she said, okay, this is what I'd like you to do. I want you just to sit or lie, it doesn't matter. And I believe she used a drum just as a kind of a basic rhythm. She said, I want you to wait. This really brings a lot of emotion to my heart because it was so powerful. She said, I want you to wait. She was not getting us ready to improvise. She just said, I want you to wait and see where the impulse to move begins. It might be in your shoulder, might be in your finger, it might be, she just said a few things, but she said, wait for the impulse. You wait as long as you need. And what happened is that we all found a way to just begin to move with authenticity. And this is where the misnomer of authentic movement came from, but we were moving with honesty and without regard for it has to look this way or it has to look this way. You know, we were not, it was not a self-conscious process. And that hooked me. She became my major teacher from there. So I know we're talking about Alma, but this is how I discovered and met Mary.
Yeah.
I can go on from that, but so there's more to talk to you about with Alma, but that was how I met Mary. And
I love these connections that you are kind of laying out. That I knew that Alma Hawkins and Mary Whitehouse knew one another and I believe did some work together and kind of in conversation a lot on the West Coast. I did not realize that Maslow was in the mix of people who knew of dance therapy and that he had a connection both to Alma and to Marion Chase. And this is really fascinating to see the outline of who knew whom
right.
at the time. And that's really lovely.
Right. One thing leads to another. During Mary's early years in the 60s, she was very connected to Abraham Maslow and all of the guys, the gang, who were involved in training programs, humanistic training programs for psychologists and psychotherapists and so forth. And her work was very much, even though Mary was a Jungian, her work very much intersected with the humanistic psychological movement.
Absolutely. So I just want to hear more about, and you can speak to both of your teachers, both Dr. Alma Hawkins and Mary Whitehouse, and just share a little bit about your experience in studying under them or learning from them. You already started a bit with this beautiful image of that first experience of authentic movement. So if you'd like to share a little bit more about your experiences with either or both of them.
Sure, I was thinking about this a lot and took some notes, so I'll be glancing down from time to time. But Dr. Hawkins was a dance educator. That was, you know, she was in New York. We became friends, and as you know, I was brought onto the faculty in the early 70s and worked and was on faculty for 10 years and worked with her all the time. She was a dance educator, and though she was in New York with all of the famous choreographers, and you know, that were there and studied, she was primarily interested in developing dance education at the university level. And she taught dance history. She was very involved in helping us form our own theoretical constructs. And the thing that I really appreciated about her is she also was very interested in creativity and the creative process. In fact, my master's degree under her was about creativity in movement. I'm just thinking about when I was working with her in the early 70s, we organized a 6-week summer program. She brought Dr. Jacobson, who had written a lot about the relaxation response, and it was all about working at a very sensory level with movement, and she was very interested in that. And she brought a number of wonderful, well-known people in the field of body and movement. And the work she did at Neuro Psychiatric Institute was primarily with older children. And she did a lot of, she helped kids who were actually having physical problems in terms of the crossed extensor reflex, for example. So she would use bands to help kids to walk, opposite legs and arms. But she did a lot of other creative kinds of things with these kids. And she did several video performances and explanations of that work. And the thing that I remember is that she did not get into the emotional, she didn't get into the next phase of what I would call the therapeutic process. She did not so much get into, she listened. She was a wonderful listener. She reflected. She was very much a reflector of the person's experience. But I think she realized she was not a psychologist, and she simply did not go into how the emotional process in the movement experience might connect then with a person's inner world or life experiences, trauma or whatever it might be. That being said, she was a seminal person, I believe, in bringing dance and then dance therapy, because she started the graduate dance therapy program into the academic setting. So she was my teacher, she was a mentor, she was a wonderful person. She was getting me jobs left and right. I taught at Mount St. Mary's College, and as I was getting more and more involved in dance therapy, she was sending me to jobs in some of the psych hospitals in town, which I later used with my own students for placements and so forth. She was a brilliant woman. Of course, she wrote several books, as you know, or may not know.
Did you want to talk about Mary in that same kind of context, about your experience of studying under Mary Whitehouse and what that was like for you?
I studied with her from the early 60s. She died in 1979 when she developed multiple sclerosis, which was just tragic. But even then, when she was in quasi remissions, she would do workshops in her wheelchair. So, as you probably have heard or know. So let me talk a little bit about her. So basically, I knew her from 63 until she died. First, I started working with her. She had a studio in Santa Monica, and I worked with her in ongoing groups. She would have weekend groups. There were a group of us who were, she called us her second generation. They were women around my age. We were all in our 20s. So we had an ongoing group with her weekly. And then there were a number of long weekend sessions, men and women. And then I also, of course, worked with her privately. I have a couple of anecdotes I can share. And then she also was involved, I don't know, being from the East, if you've heard of Esalen Institute. Are you familiar with Esalen?
A little bit, but if you want to speak about it for those that are not.
Well, Esalen Institute was just kind of beginning. It was a venue in Big Sur, California, on the banks of the ocean, on the cliffs over the ocean, Pacific Ocean. There were a lot of humanistic programs that happened there. Fritz Perls was there, Gestalt. In fact, there's a funny story at one of Mary's, I think she had 2 or 3 weekends. I can't remember now totally, but there were a number of weekends up in Esalen, and Fritz Perls was kind of wanting to follow her around to try to come into her group. And fortunately, she did not let him into her group, into the class, because he was I met him, I knew him. I did a kind of a session with him and a group of graduate students, and he was a very strong personality. But there were a number of people like that who were up in Esalen doing wonderful work, including Gestalt work. So the individual work I did with her was ongoing, and she was kind of like a mentor as well, because she gave me openings to other kinds of teaching. Connecticut College one summer with a colleague, Diane Fletcher. The private work and the group work is what I think informed my own teaching and my own work with patients over the years, and including when I was in, also, of course, it totally informed my work with my graduate students when I was teaching there.
So I'm wondering if for each of them, there's something specific about their teaching that stood out the most to you, whether it was stylistic or content related, but what about their teaching sticks with you?
Well, I think with Alma, she was wonderfully technically astute.
Mhm.
And of course, there were other faculty that I also worked with in choreography and other kinds of modalities. But the thing I remembered that I loved, of course, because I preferred improvisation, I preferred creative choreography anyway, just in terms of my own personality, which is why I think I was drawn to movement therapy. And so she always would work with that, with the whole creative process going on. It was not just a strict technique kind of thing. She also had been influenced by Dr. Jacobson. So we did a lot of quiet work on the floor as well, which of course is what Mary often started with, not always. So that's what I kind of remember about Alma.
Mhm.
My primary memories are when I worked with her and we would run these workshops together. She would do a lot of the theoretical work. I would do most of the experience. We both did experiential work. She was a wonderful teacher and obviously influenced me in these ways. With Mary, the thing that I think stands out with Mary, and at the time when I was working with her, I had just started a first psychodynamic psychoanalytic an analysis at the time. Her focus and her training was Jungian, which of course was different than basic Freud, but even then Freud was not strict Freudian. I mean, it was looking at the psychodynamic process instead. My work with her was, whether it was in private work or group work or workshops, it was always on 3 experiences: allowing, waiting, and following. Meaning waiting for the impulse. And if you have to wait, wait. A lot of people come into dance therapy from dance. And I noticed that when I often would, when I would teach first year undergraduate students, and their movement beginnings would often be very stylistic, balletic, contemporary, whatever. And the thing that was so important and what I think made her work so honest, and she called it movement in depth. She never called it movement. Her deeper movement work was the waiting until the impulse. And it just might be a hand that would then take you somewhere, you know, wherever that might go. So I think that was one of the things that was so primary to her work. It was a way of following the movement to see whether it brought you to standing, to see whether an image, an internal image, like a dream image or a memory or something, brought you to that, and to follow through with that. I think the best way to describe it, and I've tried to describe it to people who are not movement therapists and who are maybe psychotherapists or just a layperson, most people know what improvisation is, movement improvisation. And we've all seen it, we've done it. There is always, if you're doing a good improvisation, you're going to use space, you're going to use time, you're going to use weight, you're going to use the 3 dimensions, and you're going to do them in different ways. You're not just going to probably do this, for 15 minutes. That's a product. Even though it's improvisation, it's still a product. Her work was about process. It was about following the movement and seeing where it would take you, as I've already described. And so that the process moves toward a way or a means of understanding oneself. By understanding oneself, I mean understanding maybe a specific part of oneself or a specific aspect of one's own mind or a specific memory that triggers something important. That to me is where it moves from the movement process into a psychological experience that then can be verbalized, which she always did. In groups, we might verbalize with each other and then share with her, share it as a group. But in the private work, she was working as a psychotherapist, a movement psychotherapist. I can give you an example, an anecdote,
Sure.
because something I remember, one of the things that she did, and of course, this is part of Jungian thinking, are the archetype metaphors, the archetype, what would you call them? The visual events, like a cave or like an ocean or, other kinds of archetypical events or images that can actually be put into movement. And she did not give me this particular image, but when I was working with her one day in her studio, starting on the floor, lying down, I had a feeling that I was on a ledge, that I was on a cliff. I didn't go in thinking about this particular challenge I was facing in my life and my work. It was specific to my work, my professional work. But I had this image of lying on a ledge. And in the movement, I allowed myself to kind of roll off the ledge. Obviously, I was on a flat surface, but roll off the ledge. Then I was in a meadow with grass and dandelions and trees around. It was almost like a waking dream. I could literally see this. I was in this image. And then I continued exploring to a place that I think it was by a little creek or a stream that was like a quiet, safe place. Okay. So, and then it came to an end. And again, Mary would often talk about really tuning into when something is finished, when completed. You don't have to have a little coda to something. So we talked about it and about this particular movement process for myself. And it was a challenge in my professional life that was about taking on something new. And to use another kind of metaphor, in a sense, it was like taking a leap off a cliff, taking a jump somewhere. In the movement process, I discovered that my worst fears weren't realized. In other words, I went ahead, rolled off the cliff, found my way, and I used that as an opportunity to help me take a chance in real life.
Mm.
So that's an example of in the private work.
Mhm.
The thing that in terms of working with her that I also have wanted to, and I've said this in other kinds of workshops that I've led or whatever, is that she did a lot of work that was very quiet, starting slowly, but she also did work that was, she talked about the Apollonian and the Dionysian. The Apollonian being using technique as a way to sense how your body is moving. For example, I don't know if you can see this, but she would just have us be lifting the arm so slowly that you could actually feel the weight of the arm. And when you're studying dance per se, that's not where you start. You're taught to lift the arms and do whatever you're doing. To really feel the weight of the arm, to really feel the weight of the leg. Mary had done some work with Charlotte Selver, who was another teacher of mine. She's since passed away years ago at about 103, and did some wonderful work called sensory awareness. And Mary had done some work with her that I'm sure influenced her work as well. So Mary did work that was both technical, but also sensory awareness kind of work. And also then moving into range of movement. She would work with closing and opening in increments and feeling the difference, because as we all know as therapists, this feels really different than that, for example. And then obviously the moving upward and through space and interacting, and so there was a wide range of work that she took me and others through that I think is important, because particularly when she was ill, and when she was bedridden or in a wheelchair, she did a lot of work, I think, with people that was very quiet. And so there wasn't as much of the full on kind of movement process. Those are just some examples that I can give you in terms of what to work with her. It was joyous. It was challenging. It worked very well with the other work I was doing in psychotherapy. So, yeah.
I feel like when you speak about these anecdotes and these stories, you're right back there where you were. Like, they feel very alive still in you. And so I'm going to tap into that a little bit more and ask if there is a favorite or a fond memory just about your time of becoming a dance therapist or beyond that you can share with us that really kind of can take us back into that space again with you.
Sure, absolutely. I think some of this of the memories are going to kind of move from being a student to a therapist to a teacher, because those all kind of work together. I think the luxury of moving or of stillness and the impulse, waiting for the impulse, and then the spontaneity, because she really talked a lot about letting the movement become spontaneous, which is what she meant by honesty. And I think the luxury and the joy, whether I was in a group setting or with her alone, it was very powerful. And especially when you're a busy person and you're pursuing degrees, as all of us know, and or you're working 5 jobs or in school, or you're teaching or whatever, working. To have that kind of time, that is kind of given to you to wait and to feel the experience of silence in your own body and yourself, and then to wait for the spontaneity of movement and to see where it takes you, and to enjoy, and that whole creative experience, whether it's with one other person or 3 or 5 or the group, or it and that carried through for me, of course, working as a therapist. And I worked both in graduate school and out including when I was teaching, I was working in a community mental health center in downtown Los Angeles area in doing all the movement therapy sessions, as I did in New York and as I did in London, when the two other places I live. And to be able to see human beings who are not dancers begin to find that experience is just joyous, joyous. And that's the same thing when I was teaching in the graduate program, to facilitate, because we're just facilitators, obviously. It's like in any psychodynamic psychotherapy, we're just helping uncover what's already there so the person can find it for him or herself, themselves. So I think those, if that's helpful, I think those are my memories. I think the experience of talking to Michael, the fellow who started Esalen, and talking about, because I was very involved in the whole humanistic movement that was going on at the time. Those are wonderful memories. They're very encoded. You know, I like you say, I can just kind of bring them up. Right.
Yeah, I love this acknowledgement of, and I imagine, just for clarity, that we're speaking about Mary Whitehouse when you talk about that space, right?
Yeah.
And I really appreciate the naming and the invitation for stillness, because I think that we forget that's really important, that pause, that stillness, that waiting for. And not only did you learn that and experience that studying under Mary Whitehouse as a student, but also taking that concept and bringing it into your life, and it being encoded in you, like you said, to allow for pause and stillness, and the importance of that in the work. And I love that is your memory, and that is what you carried through in all of those stages of student, therapist, educator, and I imagine human as well, right?
Well, you're reminding me of something that I hadn't thought quite about this specifically, but in terms of my own personal life, my own personal style, because I'm very high in timing. Do you know who Warren Lamb was? Is that name?
Of course.
Well, my doctorate dissertation was a validation study on his work, and I knew him. In fact, I introduced him to his wife. And the experience of recognizing that one can move from task to task in one's life and take pauses, take moments of silence. And I think that's something I've really learned, that we don't just run through our life, retire, and then die. But our life has to be a series of, we call it recreation, but it's recreation, and including quiet and silence and stillness. So it occurs to me that I think that's something I hadn't thought about consciously so much, other than I know that that's what I need to do in my life. But I think that certainly relates to her work and to what she was, the most essential part, which I was going to get to the essence also of her work, which we're already talking about. But the essential piece, which I think can be missed, because I think that often people think, okay, I've lain here long enough, I better feel something and start moving.
Right.
And then it contaminates, that's kind of a strong word, but it biases the possibility that this might move to that, or this might move to that, to something else, rather than some notion the person has that, oh, that this has to be authentic, so I've got to go here. And I just think that waiting for the impulse and trusting it, you talk a lot about that, just trusting it's gonna come, it's going to arrive. You're not going to simply lie there, you're not dead. You're not in a coma. So,
Mhm.
yeah, so I'm glad you're reiterating that part.
Yeah. So we are starting, and just for clarity of the interview and the conversation, um, moving into this idea of what the essence of the practice of dance therapy meant to these women that you studied with. So if I know it for some people is quite a large endeavor to think about the essence and what their teachings could distill into. But if you could think possibly a little bit about both Dr. Alma Hawkins and Mary Whitehouse, and speak to what you might interpret or understand the essence of each of their work to be.
Sure. I think that what they had in common, coming each from really dance education and then the Jungian experience and theoretical construct and all of that, was creativity. It was that out of the creative process, and it was Alma's, all the books lots of books that we read and discussed in graduate school about creativity and the creative process, and recognizing that when people are anxious, you can't be creative. It blocks creativity. And so what permits loss of anxiety? Has to do with a calm, quiet, untense body. This was also Jacobson's work. And I think that was the connection that I can see. I think that the part of my work with Mary particularly, I think Alma and a number of other movement therapists at the time, I think presumed, and I can't speak for them, and I don't know if they wrote this, but I know with some that I worked with, they presumed that the meaning of the experience would come through the movement, okay? Because what I've come to over these many years is that the meaning is the essential piece of movement, sensory work, all of it, having the value that one can then translate into one's life. So the meaning from a very unconscious, spontaneous movement process is about bringing that movement experience from one of the books that I think we read in Alma's courses was called The Felt Thought Experience. It's more than a feeling, and it's not just a thought. And it's something I talk about with patients all the time. If they say, I don't know where to start, I'll say, well, start with what feelings you notice in your body. These are people I'm working with verbally now,
Mhm.
on Zoom or whatever. And because if you wait, you will discover that the feeling has some body locus, and then a thought might come from that. So the idea that using the felt thought mental processes into verbalizing with your therapist or in a group with the therapist, however, whatever situation it is, as a way of then connecting what the image is, what the sensory experience was, what the interactive experience was, how that eventually connects into your own life and its meaning in your life. So that it isn't just the movement will somehow bring you enlightenment. We are thinking beings as well as feeling beings. We look for meaning all the time in our lives, it seems to me. I mean, most of us. It's through the conversations, the interactions about the feelings, about the thoughts in the verbal interactions. And I don't mean over intellectualizing, just the verbal conversations with your therapist, that your movement therapist, that something can be, a question can be asked. I mean, the person can ask themselves, oh, that really, or, might be an association. That reminds me of blah, blah, blah. Or the therapist can ask the question, how does this experience and what you're getting from this image relate to your life, etc. So I see the two coming together, that we are a mind-body construct. We're not walking around or a body existing. Is that helpful? Yeah.
That is, that I think there was a lot of information in that to kind of work with, and I'm wondering if I were to challenge you to say, in accordance with Dr. Alma Hawkins' work, the essence of dance therapy is what? Like one phrase, or could you do that even?
I would say it's a phrase.
Mhm.
It would be finding meaning through the use of movement as a psychological experience.
Mhm. And then for Mary Whitehouse.
That was Mary.
Oh, I'm sorry. And then
That was
Alma.
Mary. That was Mary. Okay, so for Alma, it would be experiencing the creative process within the movement event
Mhm.
that could open a person up
Mhm.
to self-acceptance, self-awareness, all of that.
Mm.
When I worked with patients in a psych hospital out of London in Essex years ago in the 70s, and these were all patients who were, well, there were different units, but the patients who were blatantly psychotic and had a lot of difficulty interacting, I would start very Marion Chase style. I would start in a circle, and I would simply have them say their name. Most of them remembered their names, and some movement with their name, and then everybody would mirror that.
Mhm.
And the whole idea of Sally did something very unique and very different, and look, so and so is doing her thing, and really is supporting the differences and the uniquenesses of everyone. So I think that was a lot of where Alma would have been coming from too, and
Mm.
it's certainly part of my own work.
Mhm.
But to me, I think as a psychologist, psychotherapist / educator, I think it's when it can go into how this works in your life. What are the metaphors? What are the analogies in your own life? That would be the way I would think about the essence of the work.
Mhm. Yeah. So you started to go in a little bit to clinical work and your work with some of the patients and clients that you worked with, and I'm wondering if there's one specific example of a really poignant or meaningful client experience that you had that you can share with us.
Yes, there is. There's
Mm.
several, but certainly this one really stuck with me because it's I've often talked about insight in my own practice as a rheostat, not a light bulb. It's not a switch that all of a sudden, it's not the movies, it's not it's not the novels, it's not suddenly everything is, it's not a lot of the later kind of group processes that promised you enlightenment in a weekend. It wasn't that. It was a slow lightening up of awareness. This was an experience with a bipolar woman when I was working in Los Angeles. I think I had come back. I think this was after I'd come back from London. We'd come back. And I was working in a community mental health center again. And this was a day treatment in outpatient program.
Mhm.
So this woman, probably in her 50s, very, very, in a very manic phase. I mean, she was not hospitalized, but she was, was on medication. And she was talking fast, she was moving quickly, she couldn't slow down. So I was working on a one-to-one with her, and I invited her to start with doing nothing, just lying on, I think I had her lying on her back. I set the context of what if you started just lying comfortably, she was on a mat or a blanket, I forgot, on her back, and just waiting. So this is back to the issue of waiting and allowing and not forcing. And after number of minutes, I said, see if you can begin to find a way just to turn over. Just to turn over. Not, I wasn't going to say wait for the impulse and see where, just to turn over onto your stomach. And slowly, very slowly, she began to do that. Just first it was a shoulder, then it was her hip. It was just, and I didn't speak very much. I think also that's another thing that I loved about Mary, and I've tried to do in the movement therapy work, is you don't have to be talking people through the whole thing. You let them find their own way. You don't complicate it with too many words. So she slowly turned over, and she looked up, it's going to make me cry again, and burst into tears. Makes me feel that. I mean, this was like 1965 or 67 or 68, something like that. And she said something to the effect of, I never slow down, never slow down. And it was very powerful. It was powerful for me and her. I mean, so powerful for me, because it was such an awareness of, well, it was an awareness that she doesn't slow down. And then we got into, what do you think the purpose of the not slowing down? I didn't start talking about depression. I just waited to see. And she said, well, maybe there's some things I don't want to really feel, look at, feel, whatever. I don't remember the entire therapy session, but that was a really powerful one.
I think it's those little subtleties that are really profound, right? That we as dance movement therapists, we can see them and we think, oh my goodness, they just rolled over from their back to their stomach so slowly. Did anybody else see that, right? It's the little things that really speak to us so deeply.
Absolutely. And I'm just thinking back to Claybury Hospital out of London in Essex. I would have, these would be, I hate to use this term because it just sounds so crass, but this is what I was told from the sisters, the nurses because I worked 3 days a week, and I went to about 7 different wards in the day. And they called them, quote, burned out schizophrenics is what the term was. And what these were people who often had tardive dyskinesia, which is the newest thing now because too many meds, and were pretty emotionally insulated. So when I would have them in a circle sitting, and we would be doing some kind of simple movement process, over time, they began to interact with each other. I would just say, what happens if you just put your hand up and just, it's the mirroring technique is that basic one, but, just do a little, and over time with a number of those particular units, these were women, these were all women in these units, were talking to each other. And like in normal conversation. And so it was a very wonderful, and it felt like it reminded me of probably the work that Marion did. I met her and had her, I'll tell you about that in a minute, but I never worked with her for a period of time because she was on the East Coast, but that she probably experienced and discovered in her work,
Absolutely.
So I think oh yeah, there's one other experience when I was working in this hospital. I was on an intensive unit, ward unit. They call them wards.
Mhm.
And there was a very angry woman. And this was from my reading about and talking with Marion when she came to, when I was teaching, not teaching, I was therapist at Bellevue Hospital when I was living in New York for a couple of years before I moved to London. And I invited her to come and she did a group and then we were talking.
Mhm.
And I know from some of her readings that she would often mirror the energy of the patients and the movement, the the levels of tension or the use of force, however, whatever that was, light to strong, whatever it was. But this patient came over to me, this big woman, and I had a belt on my pants, I guess, on my whatever, and she grabbed it, and just it felt instinctive, but it was something I obviously learned, and she yelled and pushed back, and she let go because it was a somewhat dangerous situation. There was not a nurse right there. I mirrored her energy.
Mhm.
I mirrored her energy because I remember talking about that when I got home that night, about how immediate that worked. Now, I don't know if that would always work. I mean, she was in an intensive care unit. She wasn't isolated because she was so dangerous, but she was just testing the waters, I think.
Mhm.
And so anyway, I thought that would be an interesting one to share as well, because it's,
Mhm.
different. So,
Yeah, such a variation of experiences that you've had, right? From the tiny subtlety of the slowing down and turning over to the abruptness of the grabbing and what does that look like? And I agree that, it may have worked with other people and it may not have. And I think it's just a matter of being in that moment and relating and being attuned to somebody to understand, in this moment I need to push back, or in this moment I need to embrace, or in this moment I need to ask questions, right? Or whatever the case may be. But it's just I appreciate the variation in each of your experiences.
and I think Mary actually addressed that one time in one of her conversations or lectures, that, she worked with people who were functioning in the world. She
Hmm.
didn't really do hospital work. So it's kind of like form follows function, in a way. It's like the environment and the level of capability, mental and emotional capability of the individual would absolutely inform, the form that one
Hmm.
takes. I remember when Marion Chase came, I was on working in it was a unit that I was asked to kind of create a kind of a community mental health unit, because I had come out of community mental health in Los Angeles. So I invited Marion. I guess I'm trying to remember how we got together, but she came to do a class. There was no way you do movement therapy at Bellevue Hospital, at least back then, on the floor. You don't start on the floor. The floor is tile, linoleum tile. It wasn't particularly clean. I mean, it was
Hmm.
relatively clean, but it wasn't a rug, it wasn't a carpet. And she started up. She always started in a groove, leaning and backing and, a particular way. We talked about this later. And I realized, that makes so much sense. The form of your work is going to have something to do with where you start practicing.
Hmm.
So I just sharing that with you because,
Hmm.
Mary cleaned floors and carpets and whatever, and started on the floor often, not always, often started moving around. But so I just thought that was kind of, an interesting
Yeah, absolutely.
understanding. Yeah.
Yeah. So thinking about all of the knowledge you've picked up along the way from these different women that you've encountered and studied with and worked with, Is there anything particular, knowing that, therapy is a world that shifts once we have more information, it shifts and transitions, and as our world shifts and transitions, is there anything particular about the practice of dance therapy that you would like to see held on to for future generations of dance therapists? It shouldn't slip through the cracks.
Well, yes, I do. Yes, because certainly as I pursued my doctoral studies and then got very involved in object relations theory, which of course object simply means person, but really understanding the internal processes that make us a complicated mixture of, these internal objects, the important ones that we've internalized from childhood, parental objects or siblings or whatever that might be, but human objects, and how that can be utilized as a process in the movement experience. In the movement, for example, I mean, there are many different ways to work, obviously, with the quiet movement, the interpersonal experience, the use of imagery, and so forth. I think bringing in the newer understandings of psychodynamic and the post-Freudian psychodynamic psychoanalytic theories of how our internal objects, that it isn't just memories that create our inform our personalities, but it are these internal human, not just memories, but incorporations that inform who we are, including our healthy aspects and the ones that aren't so healthy.
Mhm.
And so ways of using that, besides, of course, what I've already been talking about, which is moving from a place of waiting and stillness and listening so that the movement can be authentic, because one can move all different ways in movement therapy and think it's authentic, and it's not authentic.
Mhm.
It looks authentic, but it may not really be coming from that place inside. And so besides that, which I would hope would be something that could be carried on from Mary's work, which is renamed Authentic Movement, but she didn't call it that. She called it Movement in Depth, and that's really what I think it should be called, but okay. So I think that you're asking me, what else do I think we don't want to lose? Is that correct?
Mhm. Yeah.
So I think that, and then I think the interpersonal experience, I think both working in, I did, when I was teaching at UCLA for a decade, I was also doing the extension courses. And then I, had private patients. I had a private practice at the time as well. But in the group work, having people interact with each other non-verbally can be such a powerful kind of experience.
Mhm.
I mean, working, because I did a lot of work with large groups and smaller groups. And do you remember the movie Harold and Maude?
Mhm.
Okay. One of the things that she said to her young protege was, how did she put it? It was so great. She said, we're all the same species. She was involving, she talked to everyone. We're all the same species. And I borrowed that
Mm.
because when I would work with large groups, I would have people just moving around the room, just alone, walking by themselves, and then suggesting that they peek every now and then at someone. Just take a look. They don't have to stare at them, but just take a look. And then I would often say, remember, we're all the same species.
Mm.
And somehow that seemed to be such a powerful meme. you know, such a powerful statement. It's like, yeah, that's right. We're strangers, but yet we're not, you know.
Mhm.
And so I think that the interpersonal part of movement therapy is important when it's not laid on top of of the patient or the student.
Absolutely.
When it's allowed, because that's also the way Mary worked, you know.
Mm.
And I
Mhm.
think that was a very important part of her legacy.
Mhm.
So
Yeah. So as we come to the end of our time together, I wanted to just ask if there's anything that you'd like to share that I haven't asked about, or anything else that you.
sure. Well, yes, I took some notes just about
Mhm.
anything else. I think they contributed significant, like in really significant ways, each in their own way. Uh, and I think that, as I've already said, I think Dr. Hawkins opened up the academic and the psychiatric field and the whole world of human behavior that of you know of the humanistic movement in psychology, which is also Mary did much the same within the humanistic and the Jungian community a lot. I think that working with the impulse toward physical movement, guided by the unconscious, guided by internal psychological experience, in a unforced, unselfconscious manner, is really what both of them, you know, were up to.
Mhm.
Going in slightly different directions once this would occur. Um, And by the way, when I taught choreography, when I was teaching at Mount St. Mary's in one of my gigs, twice or three times a week, I would use this kind of work with my dance students as a way to help them into choreography, as a
Mhm.
way to help them take something into the next step in forming a choreographic piece. So it, you know, I can see that the mind body connection between our physical organisms, movement of our physical organisms, and the psychological process is like that which I think makes us makes the world of dance movement therapy and the field so important, because it really, and you know, now there are many different kind of mind body orientations and so forth. I think they all came out of these early pioneers.
Mhm.
So, oh, the last thing I do want to add, in my private practice, and now of course I'm doing a lot up here because I live in Lake Arrowhead. We live in Lake Arrowhead, but and also because of COVID, I started doing a lot of Zoom sessions. But even in my private practice, if I were not doing actual movement on the floor or in the room, I use my movement therapeutic education and training to, and when I was in graduate school, I did some papers on this, looking at all of these different modes of nonverbal communication. There's the ocular mode, there's the kinesic, the small, you know, movements in the face and hands and so forth. The kinesthetic, you know, many different types of nonverbal behavior. So that I use when I'm speaking to someone, looking at someone, looking at a couple, you know, simply sitting down. I think that movement therapists can use our background and our training in all of these ways as well.
Yeah, thank you for that. I think this leads into our closing of our time together. And with that, I do have an invitation, and I've been watching your movement throughout our time together in our conversation, and it's really apparent and prevalent and beautiful. And I would like to, as a closure for our conversation, invite you to do just a little bit of movement if you would like, and I will join you.
Okay, you know, I've been accused of being Italian. not accused. I mean, people have asked me because I've been really trying to keep my arms quiet. I speak with my hands and arms. I just do.
Mhm.
My mother told me I was part Northern Italian, so I don't know. Scots, Irish, English, but whatever. But I don't see how people can talk without using their hands.
Mhm.
So yeah. So what would you like me to do?
Anything you would like, and I will just be here moving alongside of you.
Okay.
Dr. Susan Lovell, I cannot thank you enough for your time and your stories and the beautiful heart that you brought to our conversation. Thank you so much for joining me today. I really appreciate it.
Been a delight. Thank you.